my wife's OB didn't have admitting privileges to the hospital where we wanted to deliver. So that started the snowball of all of these other things that were like, oh. And I mean, I'm in the industry, so I know this stuff, but it's when it was happening to me it was very different. Like we had to maybe change providers or change our plan of where she wanted to deliver.
Welcome, listeners. We are happy to have Pete joining us today. At the beginning of his career, he administered state Medicaid programs and transitioned to a focus on wellness programming while attending the University of Pittsburgh for his master's in public health. Over time, someone recognized his keen ability to analyze data, and he transitioned into a role helping employers make sense of their claims data. Now he works for a human life science company, wrangling, summarizing, and interpreting all types of healthcare data. He's the proud dad of 3 kids, 7, 5, and 2, and I'm going to assume this means the pandemic has not been stressful at his house at all.
It's been great. It's been great. Who doesn't love some good family quality time?
Pete, welcome to our podcast. We are so excited to have you here.
Thank you. I'm so glad to be here. I feel honored to be talking to you two right now.
Well, we're all former colleagues, and you've given me tips in the past when my husband and I were expecting our first child. We're expecting our second one in August. I don't think I've shared that with you.
I think I saw that somewhere. Congratulations.
Nice. Thank you. But one of the tips that you shared was never leave your home without diapers and wipes. And I saved, so all of our, some coworkers had shared with me at the time, just various tips that were hilarious. And I have them saved in a scrapbooking box to be created later, but I loved that. So that was a great tip. I think today's episode is really exciting because I know you're going to share some additional parenting advice, maybe through a different lens. But the question that we discussed, you kind of sharing some insight into, is something you've learned that has been helpful and something you want to forewarn others about. So I will shut up and let you tell your tales.
Totally. I think my advice is going to be very basic, just like my parenting advice was. I mean, that's very basic information. Don't forget the wipes.
No, it's important though.
I was just going to say, sometimes the most basic stuff is the stuff you need a reminder about.
Right. So what I like to forewarn other people about is that your benefits and your needs can change over time. So I remember when I first got married, my wife and I, we had this high deductible narrow network plan, and it was fantastic. It worked great for us. We were able to save a lot of money and put a lot of money into our HSA, which was really super exciting for me. But then my wife we were pregnant, and things started to change like really quickly with what we needed in terms of our benefits. And it started with, we were in that narrow network, and I mean, we realized it in plenty of time, but my wife's OB didn't have admitting privileges to the hospital where we wanted to deliver. So that started the snowball of all of these other things that were like, oh. And I mean, I'm in the industry, so I know this stuff, but it's when it was happening to me it was very different. Like we had to maybe change providers or change our plan of where she wanted to deliver. So that kind of threw a wrench in our plan.
So what was that experience like? I mean, if you want to kind of dive in a little bit deeper, as far as your thought process.
So before we had insurance, kind of like for that catastrophic event. I mean, my wife is, she's a much better patient than I am. I mean, I hadn't been to the doctor in years. I probably wasn't taking my own advice that I was giving out in my professional life. So we didn't utilize healthcare a lot. We went to, maybe 1 or 2 visits a year, but that was pretty much it. And then, she has a lot of appointments during her pregnancy, and then she delivers. And I've now been to the doctor between when my wife was delivering and after we had the baby more in those 3 months than I had been in the last probably 5 to 10 years. And so there's bills coming like left and right everywhere. I'm like, I'm in a high deductible plan. I'll just pay it. I know I owe. I'm going to pay it. And then it was after she was delivered, I was still getting bills. And I'm like, I should have hit my deductible by now. What is going on? So I decided to start, and I think Marissa was on talking about the importance of the EOB. I started to like, okay, I better look at some of these EOBs and see what the heck is going on. Like, I'm still paying. And I remember one in particular, it was super confusing because she had her hospital stay to deliver, but then there was also a pediatrician in the
Right.
hospital making the rounds that visits you, and that's a separate bill.
Separate
So
bill.
we were getting this separate bill from this pediatrician, and I'm like, what is this? Why are they charging me? Like, her hospital stay was expensive enough to meet the deductible. So I'm calling them and they're like, well, she's not eligible. Your daughter's not eligible yet. So you have to pay this bill. And I'm like, okay, I'm like, I think I enrolled her through my employer at that time. And I enrolled her and I checked my benefits portal and she's enrolled, but she hadn't been signed a social security number yet. And it was for whatever reason, this wasn't even during COVID. It was for whatever reason, it was taking forever for her to get a social security number, and nothing could process until that social security number had been applied so that she could be put into the system. And then, so when I talked to my employer, when I talked to customer service from the insurance company at that time, and when I talked to that provider's office, everybody was super helpful, but it couldn't work because it wasn't in the computer, right? You know, the computers are great. The technology has really advanced things, but when it's not set up correctly, that in that regard, it would made it very difficult to make any progress with getting this bill paid. So I eventually just paid it. I was like, you know what? It's not that expensive. I'm just going to pay it. And I just paid it. And then eventually over time, I obviously got her enrolled. She got her social security number. I got her enrolled. And I actually, I'm so frugal that I tracked down this provider, not tracked him down, but, you know, I submitted my stuff to them and said, hey, this should finally pay. And I actually, the system actually worked, right? So when it all was said and done, I got my money back. I had to front it, but it wasn't that much. So it worked out well. But, you know, I started paying attention to my EOBs and my bills.
Yeah.
So, you know, I guess one piece of advice I would say is, you know, I paid the bill. I probably didn't have to pay it, but, you know, I'm thinking the worst. I'm like, I don't want this to go to collections. Like, what's going to happen?
Yeah.
So I just paid it. But in addition to making sure you open up your EOB, don't pay a bill until you see the EOB and you know that it hits your insurance, because there's all types of things that could happen with, you know, member IDs, a new child not on the plan correctly. So there's all types of setup and enrollment issues that can happen that you got to be your own advocate for. I think Anita or a couple theme kind of in some of your podcasts have been, you have to advocate for yourself, like whether it's with your provider, whether it's with your insurance company. You're really the only person, like when I think back to my daughter's situation, I was the only person that had all the pieces of the puzzle.
Yeah.
I was the only one that knew that she didn't have the social security number yet. I was the only one that knew that I was getting this bill from the provider. So you're the only individual that can connect all of those dots together. So it's a lot of onus on the individual. And I think even when you're in those high deductible plans, it's even more on the individual to take charge of not only their health, but also the administrative piece of that insurance portion.
It's a lot to think about and process, but I guess that can be the element that keeps you up at night for like the nightly feedings, right? As a new parent, you're already dealing with like, there's this little person in my life now. And so the hours of 2 and 4 and 6, right? AM. I guess it's a good time to whip out some of those EOBs and a calculator, and you know, why not? You got a kid in one arm, a calculator in the other.
Yeah.
It's a lot. And I think until you've been through it, you know, you only know what you know, right?
What's not fun to figure out at 2 a.m. is where to go if your kid is sick. So like, that's not the time to trying to figure out, oh, should I go to urgent care? Should I go to the emergency room?
Right.
Which urgent care can I go to? Do I have a 24-hour nurse? You know, so a lot of plans have a lot of different options, almost too many or overwhelmingly amount of options of where to go to access care. I know, and you have, I guess I should back up. There's two ends of the spectrum. One where you have a very limited access to care, or you have other folks that have these abundance of options in trying to access care. And it's always trying to get, you know, the right care at the right time. So another piece of advice, Jolene, review the EOBs at 2 a.m., but do not try to figure out your health plan at 2 a.m.
Good call.
So if there's like a lot of plans offer like a 24-hour nurse line, that's a great thing to take advantage of. Others have a telemedicine benefit. That's a great thing to enroll in beforehand when you have the time and you have that in your phone. That can be super handy, because I know our urgent care, that happened with my narrow network too a little bit. We wanted to go to the specific urgent care, and that one wasn't it might have been covered, but if it was emergent, but like,
Yeah.
you don't really want to like, I don't want to depend on like, oh, it'll be covered because it's an emergency. Like, I kind of want to have some reassurance, and urgent cares aren't all the same. So you want to make sure the urgent care you're going to has the services that you're going to need when you go there.
Yeah, it's kind of like doing that upfront research, just putting it on the refrigerator even, I mean, if you're old school and you still use a pen and paper, or putting it in your notes app. But you're right, that is not something you want to be thinking about at 2 a.m. and when you're tired and cranky and, trying to figure everything out.
I was just on vacation and I was planning our vacation, and there's this, I forget the exact statistic, but it's like the average person spends over 5 hours planning their vacation. And it compared the stat I read was related to like your 401k, and people spend not anywhere near 5 hours looking at the investments in their 401k. And I would imagine healthcare benefits falls in the same realm as the 401k rather than planning a vacation. So if you're taking like 3+ hours to plan a vacation, take an hour to go to the enrollment meeting or an hour to review your benefits, because it's important when it comes time to use them.
Well, I feel like one of the things that when you're expecting a child, especially your first one, and you're used to using, whether you're a utilizer of services for a chronic condition or something, you might be more accustomed to going to the doctor, but thinking about how your needs will change so fundamentally when you add a third person, a new person to the plan, and then they don't, from a coverage perspective, the care is for your wife and the baby, right? So mom and baby, that's the prenatal care until baby's here. Now baby needs a social security number. They need a suffix to be added onto the plan. And they need all of those things before their claims for the services the baby receives can flow through that claims system to make sure everything gets paid the right way. But when you think about, like, that's why I said you were kind of lucky that you broke plan years so that you could make the change, because if it's, you get pregnant in January, your baby's born during the plan year you're in. So it's, there's this kind of luxury moment of being able to say, I'm going to use services differently in the next year. And so now what is the health plan for me in that enrollment year that meets me where I am based on how I'm going to use the plan? That it's okay to change plan to plan to accommodate how you expect to be using services. Because it does changes so much. Agreed.
As your needs change, you should maybe have a different health care plan. Yeah, change the plan. Maybe you don't want to be in a high deductible anymore. Maybe you don't want to be in a narrow network anymore.
Yeah.
Always good to reassess. Yeah. Well, thank you so much.
Yeah,
I knew that this would just be chock full of great information. We're so excited that you're.
I do have one question for you guys, though.
Yeah.
How did you come up with the name?
Oh, man, it feels like forever ago.
I guess it's two-part question, because I think in the first podcast, Jolene, you said, grammar nerds, please don't judge me.
Well,
and I don't mean to name call right now, but if I've ever met two grammar nerds in my entire life, it would be the two people that are in marketing at a self-funded insurance company.
I don't know what you're talking about.
Okay.
We had a roll with UNDR, the coverage on Twitter, because it's 15
Ran
characters.
out of characters.
Yeah.
Right. And
we're so what letter do we get rid of?
So the second one, you get rid of the second one?
We did. I know. Character? It felt wrong. It still feels wrong.
Under the coverage seemed worse. Under the coverage. We eliminated a lot of letters to get down to UNDR.
I just remember the second time I had met Sarah, she sat me down and started giving me this dissertation about the Oxford comma. And I'm like,
I still feel passionately about it.
What kind of comma? So I just had to mention that. This podcast is great. I love listening to it. I love getting all the different insights from people without kind of an agenda. It's really kind of genuine. It's nice to hear.
Well, thank you, Pete.
Thank you. This was great. Thank you both.
This podcast is brought to you by Nova Healthcare Administrators. At the end of the day, every Nova associate is driven to do what is right. We want what's best for our clients and their members, and we do a great job sharing what we learn with each other. Between our colleagues and business partners, we know a lot of kind, smart, and thoughtful people who we convince to share their tips with you.
And don't forget to leave us a review, give us a like or subscribe, but more importantly, share. We will find the insiders and you share it with the outsiders. Is there something you've always wanted to understand better? Let us know on Twitter at UNDR the coverage, Pete, or send an email to podcast@novahealthcare.com.